Welcome back. It's 8:42. May is set aside as Better Speech and Hearing Month, so it really makes sense to use this time to check for any communication problems with your children. Dr. Jacque Scholl is an audiologist, and she's here to talk about the Sooner Start program and a free screening that's coming up soon. Good morning.
Good morning.
Some people say, little ones can't be tested till they're older, but that's really not the case anymore.
No, that is not the case. Our profession, along with just everything else in the world, has really, technology has really advanced to the point that we can test a baby the minute after they're born.
Right. And the earlier you find a potential problem, the better off it is for all their developmental
Absolutely.
skills.
And hearing loss is the #1 birth defect. So we are very, very fortunate that here in Tulsa, we have some fabulous hospitals that are screening. Our school system has the one and only educational audiologist, and she's kind of in a search and find mode too.
Right.
So.
Well, let's talk a little bit about the things that you brought to share with us today. Let's talk about your machine first.
This machine is a screening otoacoustic emission machine. Essentially what we do is we're testing the function of the outer hair cells. And what happens is, it's kind of amazing, this will, you stick the little probe, and we're going to test your ear in just a minute.
Let's go ahead.
It's very simple.
And we're actually going to test my bad ear, because I
Yeah.
have a bad ear, so it'll be interesting to see what it says.
Shouldn't have told me that.
You probably don't. That's right. Okay, don't tell her that. Okay.
Okay, so what we do is we put the little probe in, and it's going to send in some sounds, and then what it's going to measure is echoes back from the hair cells. Here we go.
So gone are the days of lifting my hand. Remember that when you were looking? Okay, should be quiet. So am I supposed to tell you I hear something? No, it's just be quiet.
We need to talk.
I have issues, do I not?
You didn't pass.
I know, and I have a hearing loss, so I need to get help on that. And that's pretty much what, this is just a screening guide to help you determine where to send them the next step.
Right. We do a lot of different tests, and we really don't just depend on one particular test. We're looking at everything. So we do a whole battery of tests, but this is just one that's especially useful for us with infants and toddlers. And I also have a lot of people who ask me, how do you get this information on these babies? You can see here I have a little plethora. Being a pediatric audiologist, I have to have toys.
Right.
Little things that sometimes if I'm testing them, once I get the probe tip in, we'll turn on and it'll light up.
Right.
And they'll just watch it. One of my favorites is just these little water weenies. And sometimes if you do something really silly, like
Put it on your...
balance it on your head, they'll just stop long enough that you can get that information.
Well, there are a couple screenings and opportunities, and it's not just for kids. I mean,
No.
even adults and older people can be involved in these screenings as well. The two that are set up over the next few weeks, this coming Thursday night, May the 10th, Kendall Whittier from 3:30 to 7, and then May the 24th at Eugene Field from 3:30 to 7. You do need to make an appointment by calling 594-4843. Thanks so much for coming in.
You're welcome.
I'll make my appointment and have my surgery so I can hear better. What'd you say, Alan? What? What? I'm not making fun, because we both have issues, don't we?
Yeah, we do. I have one good one and one bad one, as you well know. Okay, let's take a look at the